Dr. Vicky Roy, speech-language pathologist and co-owner of Dynamic Therapy Specialists in Baton Rouge, Louisiana. So today I want to talk to you about preschool-aged children and the extended therapy option that we have at Dynamic Therapy Specialists. So we offer an extended day program for children between the ages of 2 and 5, where they are able to get speech-language services as well as occupational services. In our extended day program, we are offering small group learning with a licensed early education teacher as well as licensed OTs and SLPs who are in the classroom. Why might you consider the extended therapy option over a traditional preschool? So when a child is receiving individual services, they are likely getting 30 to 45 minutes of individual time per day. In our extended therapy program, which we refer to as Dynamic Days, children are receiving targeted intervention all day, from the beginning to the end. During snack time, our OTs are joining in to provide targeted interventions during potty training, which is something that we are incorporating into our Dynamic Days program. When they are outside, the speech-language pathologist is facilitating the use of alternative and augmentative communication, or AAC, while facilitating peer interactions, while facilitating motor development on the equipment. We are targeting individual goals throughout the entire day versus a 30-minute one-on-one intervention that a child might receive either at their school program or at our clinic in the afternoons. Dynamic Days is better equipped to meet each child's needs, to meet them where they are, to be able to provide opportunities. Although there is an academic backdrop, there is a bigger focus on readiness for learning. How do we prepare children when it's time for them to go to kindergarten? How do we use movement? How do we use the expertise of the occupational therapists and their understanding of emotional regulation and motor development, and the expertise of the speech-language pathologist who understands early communication and social communication and peer interactions? And how do we then take the backdrop of preschool, which is snacks and outdoor time and circle time and themed learning, and how do we incorporate all of that together so that a child who is more likely to struggle in a traditional classroom, which is going to have more structure, which is going to have more of a focus on traditional academic goals, where we are able to have more flexibility to support where each child is, so that we're not seeing the same type of challenges. We're able to prepare each child before we go in and sit down for circle time. We're able to use movement, for instance, yoga or the motor lab, to get movement into children so that they are better able to focus and attend. We are able to incorporate the knowledge of all of the various specialists on our preschool team, on our Dynamic Days team, to be able to optimally provide the opportunities for growth and development for children between 2 and 5.